Again, we keep forgetting the bottom line. The bottom line is we are concerned with the serious illness. We don't walk around checking people's throats for what bugs are in your throat. And I'll tell you why. Because you're walking around with the bacteria in your throat that causes meningitis. Okay, Neisseria meningitidis. You're walking around with certain forms of streptococcus in your throat that in certain settings causes disease. We're not there to sterilize people's nasopharynx. That's not the goal here, and anyone who thinks that needs to see a psychiatrist, frankly, and they shouldn't be advising people on this vaccine. What we are in favor of, our goal is to, again, to stop the serious damage, to stop the death. So the endpoints here have to be understood. Today I see some noise about Pfizer saying that the vaccines are safe and effective in children. And when you look at that, this is an example, I'm sort of taking off from what your question is, if you'll excuse me, but when you're looking at, they say they're efficacious, well, they didn't even examine anybody who didn't get the vaccine, so they cannot calculate efficacy at all. That's just simply not possible. They measured efficacy, it seems, although I didn't see the data, but from the article, it seems they're talking about they measured antibodies. Okay, they got a vaccine, they got a drug, they injected it into kids, and the kids mounted an antibody response. We're not, again, that's not the right endpoint. The endpoint is protection from serious illness or death. That's the endpoint. So A, they didn't measure that, and B, these kids, unless you're severely immunocompromised or have a disease like leukemia, a child does not have significant risk from this virus. So you have to wonder, how can you measure efficacy for a vaccine against a disease that has no significant risk in these subjects, in these patients? I just think we're mismeasuring the endpoint here is the long-winded answer to your question. The waning protection cannot be based on a test for antibodies. The waning protection must be, are you protected against the serious consequence of the illness?
Fascinating. So I think a lot of people, when they would hear you say that there's no risk for children.
I didn't say no risk.
Okay.
I said there's a very, very low risk, no significant risk. That's a term that's very different from saying no risk.
Okay.
There are children who die. There are children who get seriously ill, but the risk is extremely small. The words minuscule come to mind.
And there's also some evidence of side effects in children, the heart inflammation.
From the vaccine?
From the vaccines, yes. And so there's been a few studies that have been done, or at least one, that try to kind of juxtapose the risk, right? Are you familiar with these?
Yes. So what we see from my reading of the numbers, although it's difficult to assess, is because many of the reports are self-reported side effects. But what it looks like from the calculation is that there is a very concerning risk of heart inflammation, particularly in young males, so teenage boys and sort of adolescent boys, particularly. And that is, multiple-fold greater than their risk of heart inflammation without the vaccine. That's what I've read. Now, is that something to be worried about? Yes, absolutely, particularly since the risk of the disease itself in those same people is extremely low. So it is not something that only I am concerned with. We look at the FDA advisory panel that just recommended whether or not people should get boosters. Mm-hmm. And they voted for a recommendation of boosters in people over 65 and high-risk people. But they recommended against, 18-0 they voted, in fact, against a broad recommendation of boosters in younger people, meaning 18 to 65. But more than that, they called out specifically the the concerning risk of myocarditis, heart inflammation, from the vaccine in young people, in teenagers. And so this is concerning to everyone, including people advising the FDA. It should be concerning to everyone, and every parent should be thinking, as a critical thinker, what's the risk of the illness we're trying to protect their child from versus what's the risk of the vaccine? And the risk of the illness is extraordinarily small. So any increased risk from the drug that you're injecting, it's a tough case to make, and it's an individual decision to inject an experimental vaccine into a child who has extremely low risk for the disease itself. Now, the other point about giving vaccines to children, if I may, is that I said this is an experimental technology. We did not have long-term tallies of side effects on this vaccine. It seems to be there's a lot of deaths from the vaccine that are reported. I'm not sure about the percent, but it's concerning as well, obviously. But we're talking about injecting children, okay? If you're 70 years old and you're taking a vaccine, your life expectancy is about 15 years. If you're a child who's 10 taking an experimental vaccine, with or without boosters, you're going to be living with that vaccine for decades.